my name is Sierra Brock, and this year I mentored at the emergency room at Northeast Georgia Medical Center. My mentor was Lee Wilson. She's an LPN in the emergency room. I mainly followed her, helped her and her colleagues with whatever they needed, such as hooking patients up to the monitor, collecting urine samples, little things like that. I also followed physicians and PAs and NPs and got to see what a day in the life of an emergency room physician is like. My essential question is identify the most commonly used drugs for each diagnosis in the emergency department and discuss the pharmacology for each drug. The reason I did this was just to help me learn all the different drugs and the route and dosage of each drug, because it really helped me a lot in the emergency room. I used a lot of different classifications of drugs. However, I only wrote or used the drugs that I have heard of in the emergency room, but there are a lot of different categories. The first is analgesics. There are 3 categories that I used for this. COX-2 inhibitors. COX-2 is just an enzyme that promotes pain and inflammation. And then I used non-steroidal anti-inflammatory drugs, or NSAIDs. And then I used narcotics. For COX-2 inhibitors, the only one that I've ever heard of them using is Celebrex, which just reduces inflammation. For NSAIDs, it's just your common ibuprofen, which is Advil, diclofenac, which is the brand name, which is Voltaren, meloxicam or Mobic, and ketorolac or Toradol. Toradol is most often used because it's a non-narcotic NSAID. And then some of the narcotics that are used most frequently: morphine, fentanyl, oxycodone, tramadol, Demerol, or Dilaudid. And those are really used for severe pain, like orthopedic injuries mainly. I also researched narcotic analgesic combinations, so something that has a narcotic analgesic and another class of analgesic in it. So for those, I used Percocet, which is acetaminophen and oxycodone. Acetaminophen and hydrocodone is Norco. Lortab, most frequently, is known as Lortab. However, it's not called Lortab anymore, it's called Norco. And Vicodin. And then acetaminophen with codeine, which is just Tylenol codeine, is the brand name. The next class is anesthetics. These are most often used to, we use these a lot in traumas if the patient is getting combative, or if we need to do a procedure on them and they don't need to be awake for it. So for that, we use ketamine, propofol or Diprovan, and lidocaine. Lidocaine is actually a topical anesthetic. It just numbs the skin. However, ketamine and propofol actually put you to sleep. It's like a general anesthetic. I also researched antiarrhythmics. We use these a lot in the emergency room for heart rates that are abnormal rhythms such as atrial fibrillation, ventricular fibrillation, rhythms such as that. And for that, there are 4 categories: sodium channel blockers, beta blockers, potassium channel blockers, and calcium channel blockers. Sodium channel blockers, they suppress tachycardias. It just lowers the heart rate. And so we mainly use lidocaine for that, and flecainide. And then for beta blockers, it increases the calcium in the cell, which therefore reduces the heart rate also. And for that, we use nadolol and propranolol. For potassium channel blockers, it delays the repolarization of the action potential. And the most common potassium channel blocker that is used in the emergency department is amiodarone. And lastly, calcium channel blockers, it also reduces the heart rate and contractility. Often for this is diltiazem. Antiemetics, it's a drug that gets rid of vomiting and nausea. It also treats motion sickness. For those, we use diphenhydramine, which is in Benadryl, Dramamine. Most people use that for motion sickness. And then Zofran and Phenergan are the ones most often used to eliminate nausea. There are also antidotes used in the emergency room. For example, charcoal is just used as a natural absorbent in the body. The one I have heard most often being used is Narcan or naloxone. It's for if you have overdosed on an opiate. If you give that to them, then it will reverse the side effects of an opiate overdose. And then atropine, I haven't heard of this one being used, but you use it if you have been poisoned by a pesticide. The next are antibiotics. Amoxicillin and penicillin are the ones most often or most common that most people have heard of. It's used to treat chlamydia and other general bacterial infections. The ones I have heard of the most are Zithromax and erythromycin. Zithromax is for otitis media or an ear infection, pneumonia, STDs, or pelvic inflammatory disease. Erythromycin is for like skin infections or ocular infections. The next, antihistamines. It's a pharmaceutical drug that opposes the activity of histamine receptors in the body. And those most often are diphenhydramine, Zyrtec, Claritin, and promethazine. We don't really use a bunch of those in the emergency room just because they're non-emergent illnesses. We do use hypertensives a lot because just to reduce blood pressure, and it prevents things such as a stroke or myocardial infarction, which is a heart attack. There are several types of this medication: ACE inhibitors, beta blockers, and diuretics. These include lisinopril, metoprolol, Lasix, cardizem. We use cardizem a lot in the emergency room just to lower the blood pressure and to get the heart rate in check. Another one is anti-hyperlipidemias. We don't really use these a lot in the emergency room just because, again, it's not really an emergent case. You would use these more with your primary care physician. But patients do come into the emergency room that are on Lipitor or lovastatin or Zocor, and so it's important to know what these medications do. The next is antipyretics, and this just reduces a fever. And these are just aspirin, acetaminophen, which is Tylenol, naproxen, which is Aleve, and ibuprofen, which is Advil. The next is bronchodilators. The respiratory techs use these a lot to for like pneumonia patients to break up all the mucus in their lungs, or for like COPD patients. And these are just albuterol, salmeterol, and then there's also another one which is epinephrine, or commonly known as